Welcome to the 4sight Health Roundup podcast, 4sight Health's podcast series for healthcare revolutionaries. Outcomes matter, customers count, and value rules. Hello again, everyone. This is Dave Burda, news editor at 4sight Health. It is Thursday, August 3rd. Your window is closing for a summer getaway, so start making some calls. It's not too late. There are plenty of places you can visit and not have to cut the grass or take the garbage out to the street. Speaking of visit, on today's episode of the Roundup, we're going to revisit one of our favorite topics on the show, private equity investment in healthcare. That's courtesy of two new studies. The first from the American Antitrust Institute, the Petrus Center at the School of Public Health at the University of California at Berkeley, and the Washington Center for Equitable Growth. The second from researchers at Columbia University in New York, published in the British Medical Journal. The cool kids say BMJ. I'm not cool, never have been, and I always bring an extra pencil to a meeting just in case. Let me briefly summarize both studies. The AAI study said PE acquisitions of physician practices are increasing. PE firms are amassing high market shares in local physician practice markets. PE acquisitions are raising costs and prices for physician services, especially in markets where they have a 30% or more market share. And most PE acquisitions of physician practices fly under the radar of federal and state antitrust regulators. The study in the British Medical Journal, meanwhile, was a meta-review of 55 individual studies on PE ownership in healthcare. Based on that meta-review, the study said PE ownership was associated with higher costs for patients and payers. PE ownership was associated with mixed to harmful effects on the quality of care. And, quote, no consistently beneficial impacts of PE ownership were identified. Close quote. The question raised by both studies is whether we need more oversight of PE acquisitions in healthcare to protect patients. That's the question we attempted to answer on our April 27th podcast, Private Equity Penetration and Policy in Healthcare, featuring Dave Johnson, CEO of 4sight Health, and Julie Murchison, partner at Transformation Capital. So why don't we listen to a rebroadcast of that episode right now? Okay, let's get on top of this private equity thing. A new report out from Bain and Company says PE acquisitions in healthcare globally totaled 350 deals in 2022 with a combined dollar value of $89 billion. That's down from 515 deals in 2021 that had a combined dollar value of $151 billion. PE exits in healthcare followed a similar trend, exits down from 244 to 233, and exit value down from $179.4 billion to $78.4 billion. Investing is not my forte, but it is yours, Julie. What's your take on these numbers? What do they say about the rest of the year? And if I'm a healthcare consumer, why should I care?
Well, as the co-lead of Bain's healthcare private equity practice said, healthcare private equity has earned a recession-proof reputation, typically outperforming overall PE activity during economic downturns, end quote. We all know that healthcare is, relatively recession-proof. But, despite its resiliency, we also know the high interest rates and these crazy labor costs that healthcare has really been dealing with, along with the tight credit markets, are making investment as a sport and as an important part of our innovation economy a lot more challenging. So a lot of slowdown being seen here. And frankly, I think probably much needed focus on true value creation versus just company launching and, development. So economies go in cycles, right? But we all know what healthcare is based on with our aging population and chronic disease and the like. So investors are getting creative with approaches. The public markets are down. You're seeing or will see, I think, more taking companies private, carving businesses out of larger entities that are facing their own need to just streamline what they do and, not wanting to kill what they've purchased. And it's easy for me to say this because we are one of these firms, but investors that have conviction in the space and a lot of depth to really be able to identify good solutions can really, I think, make it happen here. So shameless plug, of course, for all that is good in innovation. But I thought it was interesting to see that Bain highlighted 4 areas of kind of PE hotbed. One is biopharma and life science, still pretty hot. 6 of the top 10 deals last year were biopharma, life science tools, and other services. And, I was kind of surprised to see them say that value-based care expansion is still kind of on the table because every health system I talk to is really struggling to even focus on anything related to value. But, at the end of the day, Bain's analysis suggests that fee for value arrangements will capture 15 to 20% market share from traditional fee for service by 2030. That percentage, of course, makes me a little depressed given the work that we've been doing on this for years, but it's meaningful when you really think about the larger market. Third, Bain said that 2022 was a breakout year for generative AI. I think we all know this given our obsession with ChatGPT. But when you look at where AI has been used in the back of the house, basically, to automate payer and provider back offices, supply chains, therapeutic discovery, things like that, AI is really now making its way into the front of the house and imaging and text generation with consumers and others. And last, they really focus on healthcare IT, which it sounds like massive buyout activity in healthcare IT, really focused on the provider IT space, but also biopharma and payer IT catching up. Biopharma is increasingly looking at, workflow productivity and reducing clinical trial length, while payers are actually really focusing on getting their own administrative data functions in order. Thank the Lord. So, those of us who are believers, I think we're believers, believe now more than ever that healthcare's problems are worth fixing. So, when you think about consumers, we're all consumers, and healthcare touches all of us with, all-time high costs and these skyrocketing service expectations we have thanks to all the other technology and everything else that we do. So entrepreneurs have made the world a better place. And we're finding a lot of founders in at least the stage in which we invest coming in to do the same thing in healthcare. And I hate to say it this way, but capitalism has optimized healthcare policy to get us into this mess. And I actually think capitalism will get us out of it by taking advantage of the gaps in service and efficiency that technology can now tackle. So while, I'm looking at this from a much earlier lens than the big PE that Bain's report talks about, there's still a lot going on because there's such opportunity to make everyone's life better.
I filled a prescription or refilled a prescription using my portal with 2 clicks. And within minutes, it was at my pharmacy. You guys would be proud of me. I took a big step. Big
Berta,
step versus,
I am proud of you.
Versus holding for my doctor.
Good job.
Doing more with less thanks to technology. Thanks, Julie. Dave, any questions for Julie?
Well, what's next, Dave? A beeper? What do you think?
Stop.
BlackBerry?
One at a time.
Now, Julie, there at the end, you alluded to the fact that capitalism got us into this mess and capitalism can get us out of this mess. And there is an amoral quality to private equity. It chases the money. I'm just wondering if you could give us examples of parts of the industry where PE has been very helpful and others where maybe it's been less helpful.
So PE firms have really been on the forefront of revenue cycle management. We even saw some health systems like HCA with Parallon or Tenet with Conifer. And today with larger assets, those may not have been the perfect models, but larger assets, PE is pushing them towards consolidation. And these RCM businesses have been involved in massive regulatory concern around aggressive billing collection practices, violating debt collection laws, suing low-income patients, as I think we recently talked about, offering, potentially exploitive medical loans, like bad stuff, right? So that hasn't been so great. The other one of my favorites that I think is just an industry that really needs some moral assistance is the air and ground ambulance part of our industry. And they've been involved in massive surprise medical billings. The average cost for an air ambulance $35,000 to $60,000. I mean, it's just crazy. And those get billed separately. So patients get surprised by that. So it's, that's not good. But I'd like to highlight the good news. HBR actually did a study or looked at a bunch of studies. It looked at PE-owned hospitals. And their conclusion is that these PE-owned hospitals did not lead to worse clinical outcomes for Medicare patients. Everything was based on Medicare data. And for, acute non-surgical illnesses like pneumonia and strokes, they performed well and performed well across, a number of other quality measures. For things like elective surgical conditions, like hip or knee replacement, same types of results. And I will say, one exception, for heart attacks, patients were seen to even receive better care at PE-owned hospitals than at non-PE-owned hospitals. So it's pretty interesting when you look at the Medicare population. It's hard to know whether that holds for the under 65 population, but I think we all know that PE can be good as it manages business and actually tries to, perform well for other incentives, although apparently not fee for value.
I'll take the same or better for less any day of the week. That's great. Thanks, Julie. Now let's talk about this viewpoint in JAMA. It's written by two Boston-based physicians. They said, quote, private equity may fuel pre-existing profit incentives in healthcare delivery and render patient outcomes more susceptible to their influence, close quote. Directly addressing what you just talked about, Julie. They said federal regulation of PE in healthcare is limited or is toothless. Instead, they recommended that states take the lead on policy making in this area. Specifically, they said states could decrease the reporting thresholds of deals, expand executive branch regulatory authority over deals, and increase transparency of ownership. Dave, if the trends Julie talked about are right, do we need more policy oversight of PE in healthcare? If so, are states the right place to do it? And again, if I'm a consumer, why should I care?
Doctors should really stick to medicine. This is a solution in search of a problem. Let me kind of pick up where Julie was talking about in her response to my question. And it's a point I've made several times before. Private equity is like nuclear energy. It has beneficial and detrimental applications. This is particularly true in healthcare, where private equity investment can amplify the impact of the industry's perverse economic incentives. Julie, just like you were just talking about, PE owners of ER practices, and they have some big names like KKR there, lobbied hard to water down the surprise billing legislation that Congress passed in 2020. They succeeded. The arbitration process gets providers largely off the hook, provides a little protection for consumers, and has the economic impact of increasing costs. Not great legislation. On the other hand, PE has been instrumental in advancing home care models. Most believe this is a positive value-creating investment. And this, to me, is where the author's logic in the JAMA article just goes completely off the track. They see private equity as a phenomenon unto itself, when in reality, it's just simply a financing mechanism. Sure, PE firms are heat-seeking missiles for profit. PE firms will invest in companies that create or deplete value-based care as long as they can make a profit doing so. We shouldn't be surprised if we discover a knife is sharp after we pick it up. It's what they're designed to do. On the other hand, PE is simply a form of financial engineering, no more, no less. I happen to think we should tax carried interest as ordinary income. Senator Kristen Sinema prevented that from happening. Capitalism runs on investment, and efficient markets reward value creation. The problem with healthcare isn't private equity. The problem with healthcare is healthcare. Raging PE funds making investments in the industry are only taking advantage of the perverse incentives, like I mentioned earlier. And the problem is that companies in healthcare operate within an artificial economic environment where supply drives demand. So what does this do? It enables smart, well-funded PE investment firms to exploit perverse financial incentives that are baked into the payment models. Does this make PE firms any more guilty than hospitals or specialists that do exactly the same thing? I don't think so. If healthcare can clean up its economic model so that it promotes value through level field competition, the perceived PE problem will disappear. They'll still be in the game. We want and need them to participate in the healthcare marketplace. However, their investments will generate greater value for consumers because the system and the payment models actually encourage that. So if you don't know already, Dave, the answer to your question is no. We don't need specific regulation of private equity investment in healthcare at either the state or the federal level. What we do need is regulation that promotes transparency, data sharing, and leveled field competition. Get that right, and healthcare will be just fine. And private equity will still earn its profits, but they'll do it the old-fashioned way. They'll do it by creating value.
Got it, Dave. Great analysis. Thank you. Julie, any questions for Dave?
So, Dave, I'm wondering if you can riff on the importance of antitrust as something that's relevant to this discussion. This industry is really creating some highly consumer-friendly healthcare services that make people happy and hopefully improve overall health also. So I struggle, with some of the tenor around antitrust sometimes, especially because I think Epic is our biggest antitrust issue, as I think everybody knows. So tell me a little bit about how you feel about that.
First, Julie, thanks for asking that question, because antitrust is really important, and it's important for the government to get it right. As you know, I tend to be very pro-market, meaning anything that promotes level field competition, which often puts me at odds with pro-business regulation and so on. Now, in sub-markets of the healthcare industry, regional markets, there are enormous numbers of companies that have monopoly or monopsony pricing power. And that's a bad thing. I sometimes joke that nonprofit hospitals are the only organizations in the history of the world that have monopoly pricing power and still lose money. But the fact that they have monopoly pricing power artificially increases prices. So first of all, the government does need to do what it can to ferret out areas where the marketplace isn't functioning and address monopoly and monopsony pricing, get rid of it. Where I think you were going with your question, though, is a little more interesting. It's when a company like Amazon creates value for consumers despite having potentially the power to exercise monopoly pricing.
That's right.
And we haven't completely figured out what to do with that yet. And that's way beyond healthcare. I really welcome with open arms the big retail chains into healthcare, because I think they're going to fundamentally change supply dynamics in a positive way. Half of what happens in hospitals is for conditions that are either preventable or have waste associated with their treatment. So the extent to which these big retail companies, CVS, Amazon, Optum, Walmart, Walgreens, can sort of get that right so that demand is really a function and drives supply rather than the other way around, I think that will be a good thing. But as a country, I think we're wrestling what to do with the Amazon phenomenon. I think it's going to help in healthcare, partly because they haven't been terribly prevalent. But it does raise this larger conundrum. What do we do when they stop lowering prices and creating value for consumers and start using their market power just to get wealthier? Will it be too late?
Thanks, Dave. As far as the PE policy and regulation, they say sunshine is the best disinfectant. So I think the more PE ownership in healthcare, the more we need transparency to let consumers know who owns who. So we'll see how that plays out.
Yeah.
Thank you for listening to a rebroadcast of our April 27th episode, Private Equity Penetration and Policy in Healthcare. That is all the time we have for today. If you'd like to learn more about the topics we discussed on today's show, please visit our website at 4sighthealth.com. And don't forget to tell a friend about the 4sight Health Roundup podcast. Subscribe now and don't miss another segment of the best 20 minutes in healthcare. Thanks for listening. I'm Dave Berta for 4sight Health.